Hi, welcome to another edition of UOA On Demand. My name's Dino Pinciotti, physical therapist and director at University Orthopedics and the Center for Rehabilitation and Sports Excellence. Today we have a quite unusual UOA On Demand, where we have another physical therapist, Maggie Turek, who has her doctorate. We'll be speaking on a new technique that we are offering in our office in Somerset called dry needling. Maggie, welcome.
Hi, Dino.
Thanks for joining us today. Could you tell us a little bit about, Maggie, what dry needling is?
Sure. So dry needling is referring to a technique that uses a thin monofilament needle and is inserted into the body, into the skin, and it goes into muscle, ligament, fascia, and the point of it is to address pain and movement dysfunction that the patient has. The term dry needling is referring to a needle that is inserted without any medication or substance into the body, whereas you have the term wet needling, which is when a medication or substance is inserted into the body. This is what we typically think of when we talk about injections, whether it be for orthopedic reasons like a cortisone injection or for other medical reasons like a vaccination or other medications. And those needles tend to be a lot larger than the needles that we use for dry needling, which tend to run from 0.18 to 0.35 millimeters, so they are very small.
Very small filaments. I've seen them before. How is dry needling different than acupuncture?
So when you look at the two in terms of equipment and the areas that are treated, sometimes they are very similar. However, the differences come in when you look into the education, the theories behind it, and the purpose of the treatment. So with acupuncture, it is taught based on traditional Chinese medicine. Acupuncture follows qi or energy channels along what acupuncturists refer to as the meridian lines of the body. And they place the needles based on these meridian lines. So sometimes the needles are placed in areas that are not actually where the patient is having their symptoms, but is based on these traditional Chinese medicine meridian lines that they believe will affect the area that the patient is having an issue. However, when you go to dry needling, this is taught based on the anatomy of the body. So when we're placing the needles, we are going directly into specific muscles, ligaments, tendons, fascia, and we are addressing the specific area that the patient is having their dysfunction. So if they're having pain in their shoulder, typically we are treating the shoulder.
Great. Thank you, Maggie. Tell us how dry needling, how it works.
So there are
what do you
different
do?
theories based on how dry needling can affect the body. First, it helps to increase blood flow to the area that is being treated. So this new blood flow brings in new oxygen and nutrients to the tissues, and this helps the tissues function properly. Next, it helps with modulating pain. So when the needle is inserted, it helps to stimulate the body to release certain chemicals that help to manage pain. Some of these are endorphins, serotonin, norepinephrine, and along the same line, the needle does help to stimulate certain receptors in our body that would typically be sensing pain, and it helps to stimulate those receptors so that it's overriding these pain signals and the person is not feeling the pain as much. Additionally, it also helps to stimulate the central nervous system, which can help with pain relief. And then it helps to stimulate growth factors, which helps in the healing process. So this is why it can be used with many different types of injuries and conditions. And lastly, it helps to decrease sensitivity of tissues, which is really helpful in patients that are in chronic pain. Their tissues are very sensitive, so this helps to decrease that.
That's great. So you kind of touched on that briefly, but what types of patients could benefit from dry needling?
So there are many different types of conditions and diagnoses that can be addressed with dry needling. Some of them include headaches, migraines, neck pain, low back pain, carpal tunnel, tennis elbow, golfer's elbow, hip dysfunction, knee OA, patellofemoral pain, ligamentous injuries of the knee, ankle sprains, Achilles tendonitis, plantar fasciitis, and many, many more. These are just a couple of the things that can be useful, but there are so many different things that can be used for dry needling.
Are there any absolute contraindications for having dry needling done to a patient?
Yes, there are absolutely conditions and situations that would indicate the patient is not appropriate to receive dry needling as a treatment. Some of these include a fear of needles. Obviously, if the person is afraid of needles, we are not going to be dry needling them. Additionally, there is infection, whether local or systemic. Next is lymphedema, distal to the areas being treated. So if the patient has a history of lymphedema, let's say in their left arm, we are not going to be treating their left shoulder. Also, uncontrolled diabetes or high blood pressure are absolute contraindications. These people will not be getting dry needled. Additionally, active or history of cancer in that area specifically, we would not be dry needling. Acute surgery. So typically the benchmark is between 8 to 12 weeks out of surgery. Usually the person is appropriate for dry needling. However, if the person is less than that 8 to 12 week mark, it's wouldn't be an absolute contraindication, but it is something that the physical therapist would have to discuss with the surgeon that performed their surgery. Lastly, conditions that would cause the patient to not be able to remain still, as dry needling treatments can last from anywhere between 8 minutes to half an hour. So if the person is not able to stay still for that length of time, these things could be uncontrolled cough, Tourette's, unstable seizure disorders, or just a person who is very fidgety. They would not be appropriate for dry needling.
Are there relative or regional contraindications we should know about?
Yeah, there are things that may or may not make the person appropriate for dry needling. These would include a joint replacement less than 12 weeks. As I stated previously, when you get to that 8 to 12 week mark, the physical therapist would have to talk to the referring surgeon and discuss with them if they believe this patient is appropriate or not, as we don't want to cause any issues with their surgery. Next would be if the patient's on high dose anticoagulants. This can be an issue because you are penetrating the skin. There's always a risk of bleeding or bruising. So you would have to discuss this with the patient's physician, not necessarily the referring physician, but the patient's primary would be probably the most applicable for this. Next, we get into pregnancy. So typically with pregnancy, they say if the patient is less than 12 weeks or greater than 36-week pregnant, that can be very tricky, and we typically don't work outside of those timeframes. Active and systemic disorders like RA or lupus, these are, if they're having an active flare-up, then we typically would not be dry needling, but if it's not active flare-up, they could be appropriate for this. Next is implants in the area. So if the patient has any sort of hardware, silicone, an injectable filler, a pacemaker, or a spinal stimulator, it depends. They may or may not. We probably would not be going into that area specifically, but that doesn't mean they can't be treated in other areas of their body. Next is touching back on something I said a little earlier, so lymphedema. If we are not working in the area that the patient has a history of lymphedema, we could potentially be dry needling them. Then there's also needling around surgical areas. So it goes back to the surgery before, where this would be a discussion between the physical therapist and the doctor to discuss if we believe this is appropriate or if we want to wait a little bit further to let that patient get out of that acute surgical stage. And then lastly is conditions that cause poor immune function. We don't want to risk the person having any sort of issues with that. If their immune function is already down, we don't want to risk it. So recent or active cold, flu, or virus, active autoimmune issues, or eating disorders. These are things that we probably would not be working with.
That's great, Maggie. Thank you. So I'm a patient coming in to see you. What could I expect after dry needling?
So there are both local responses that you can have after dry needling and more systemic responses that you can have after dry needling. So when we go into the local tissue responses, you might have some soreness in the area that was treated, some muscle fatigue if we're working into a specific muscle, or some slight temporary discomfort in the area. Typically we say up to like 24 hours can happen. Should never be any severe discomfort though with dry needling. However, when you get into the more general responses through the body, these can be things like the patient saying that they're feeling relaxed or drowsy or even sleepy, because we are having potentially an impact on that central nervous system. So this is when it comes down to the PT to kind of monitor a patient after treatment and make sure that they're not having any issues prior to them leaving.
That's great. So I have seen in a clinic before, and I know we have it here at UOA, can dry needling be performed with electrical stimulation?
Yes, it absolutely can. Dry needling can be performed with or without electrical stimulation, and it really depends on what the therapist is looking for their goals from that treatment. So some of the benefits of using electrical stimulation with dry needling is it further increases the vasodilation in the area. So it's bringing even more blood flow to the area than just the needles alone. It increases the pain reduction response. Again, you get more bigger area than just the needles themselves. And then last, it can be used with muscle stimulation. So with patients who are potentially post-op, if there are certain muscles that are not firing correctly, you can use this to help stimulate those muscles, and it has a greater effect when you add the stimulation to it.
That's great. Can you exercise after dry needling?
Yes, so movement is highly recommended after dry needling. It depends on the physical therapist. It's at their discretion on what type of exercise and how much they would recommend the patient doing. And this is based on what areas were treated and how much treatment was actually done with the dry needling. If they had a lot of dry needling done that day, we were done a very large area, we're probably not going to be doing a very extensive program after their dry needling. Additionally, it depends on what the goals of the treatment were. So if, let's say, we're working on pain relief, typically we're going to have them exercise prior to dry needling, and then we will do that at the end because it helps to decrease their pain levels and it lets them feel good as they're leaving the session. However, if certain conditions like OA, we have found that you have a better response when you dry needle this person around their joint first, and then you have them exercise after to help load that joint. They tend to get the best benefit out of that. And then touching back on what I said before about muscle stimulation. So if we're trying to get a muscle to fire better than it is, let's say in a post-op ACL or something, typically you're going to needle that muscle or that area first. And then we're going to have them exercising with exercises to target those specific muscles that we just treated to help get them firing even more.
I've heard of a lot of professional athletes and college athletes receiving dry needling as part of their rehab or during the season to stay on the field and continue to participate in their sports. Is this something that you find would be helpful?
I think it absolutely could be used in athletes to help get them back to their sport quicker. It has been used in so many different diagnoses and conditions, like I stated earlier. And it's not just with muscular and ligamentous injuries. There's been research coming out stating that it actually helps with bone healing. So this could potentially, definitely be used with athletes to help them get back.
Great. Maggie, are there certain requirements needed to perform dry needling in the state of New Jersey?
Yes, so as of 2022, physical therapists in the state of New Jersey are allowed to dry needle. However, there are certain requirements that they have. So the physical therapist has to have at least 2 years of clinical experience. They have to have a current CPR certification, and they have to have completed the education process that the New Jersey state deemed appropriate. So this includes 80 hours of education in a New Jersey approved company. And then that 80 hours has to include at least 40 hours of hands-on education and training in dry needling. Additionally, with that, the physical therapist has to do 10 hours of continuing education every 2 years with their normal license renewal, specifically in dry needling though. And lastly, not a requirement per the state for the actual physical therapist, but in general, in terms of dry needling treatment, the physical therapist has to perform a full evaluation prior to the patient being dry needled to deem whether they are or not appropriate. And then before they are allowed to dry needle a patient, they must discuss those findings with the referring physician and have a conversation that is documented based on whether the patient is appropriate or not appropriate for this type of treatment.
Okay, great. Is dry needling covered by insurances? Currently, I know at UOA here we're providing this service as a self-pay service. Can you touch on that a little bit?
So currently dry needling is not covered very well under any of the insurances. So typically any clinic that you're going to go to, it is most likely going to be a cash pay or self-pay out of pocket expense for the patient.
Okay, great. Any other things that a patient should know about dry needling and their visit if they think they might be appropriate and are suffering with some pain and would like to try an alternative treatment? Anything else you'd like to share with us?
Yeah, like I stated earlier, this is not applicable for every single patient. A person might think that their dry needling is going to fix them. It is a tool for the physical therapist to use. It is not something that is going to cure anyone. It's just another tool for our toolbox to help treat these patients. Additionally, some people respond really well to it. Some people do not. So there's always a chance that this is not going to be the fix that the patient believes it is. Also, there are a couple things that for like more aftercare that the patient needs to know. So like I stated earlier, you want this patient to get moving after this. It helps to keep that blood flowing because with dry needling, we were causing a controlled inflammatory response. So we want to keep that going. So we always recommend the patient moves afterwards if they are able to. Obviously, if they're in extreme pain, even prior to dry needling, if that has not gone away and they're not able to exercise, that's a different story. Also, we want to recommend that the patient hydrates after dry needling, helps to flush out their system. Next is if they're going to use any sort of modality, either on their own or in the clinic, we always recommend heat after dry needling. As going back to before when I said we're trying to cause that controlled inflammatory response, we want to use heat because we don't want to use ice because that would dampen that inflammatory response that we are trying to cause. So then that would make sure we don't get those desired outcomes. And along that same line, we don't want the patient taking any sort of anti-inflammatories unless it's been prescribed by a physician. So we don't want them to go home and take some over-the-counter anti-inflammatories that are gonna get rid of that inflammatory response that we just caused intentionally.
That's great. Well, Maggie, it's been a pleasure talking with you today. I appreciate your expertise in this area and looking forward to having you start this program here at UOA in the Somerset office. So if you're in need of physical therapy, you can check out our website at uoanj.com. We have 4 convenient locations in central New Jersey: in Avenel, Woodbridge area, Wall, Morganville, and Somerset, New Jersey. So we want to thank Maggie for joining us today and hope you enjoyed this segment of UOA On Demand. Thank you.